Hi, my name is Savannah Socaris, and I'm going to be talking about the pathophysiology of sickle cell anemia. So, sickle cell anemia is a genetic disorder that occurs when a patient has abnormal hemoglobin on their red blood cells, resulting in hemoglobin S. It is also an autosomal recessive hereditary disorder, which means that when the parent passes the abnormal hemoglobin onto their unborn child, the child will then have the disease. Sickle cells are very rigid and easily cracked and broken, resulting in the cells to become very tangled inside the blood vessels and organs, resulting in congestion, clumping, and clotting.
Hi, my name is Dharma. I'm talking about sickle cell symptom and signs. Sickle cell symptoms can change throughout the life. Symptoms babies and toddlers, symptoms teens, young adults, in adults. The brain thrombosis, hemorrhage, clotting in the cerebral blood vessels can lead to stroke. Eye, retinal and conjunctival hemorrhage and become the blindness. A heart, congestive heart failure, lungs, pulmonary infects, including pneumonia. Abdominal organs is abdominal pain is common with swelling the spleen and engorgement of the vital organs. Kidney failure are common as circulation is slowed and kidneys become clotting with cellular debris. Bone in joints. Hand and foot syndrome is like unequal growth and fingers and toes infarction of the small bones in the hand and feet. Skin is stars ulcers, jaundice, which is yellow of the eye and the skin. Thank you.
Hi, my name is Shama. I'm going to explain about diagnostic test for sickle cell anemia. Um, sickle sickle dex test is one of the screening tests that shows sickling of red blood cells when oxygen tension is low. And there is another test which is called HGB electrophoresis. It detects the abnormal of HGBs. Also, additionally, the HGB lowered of red blood cell count as well as elevation of white blood cell count. Bone marrow can be used to, like bone marrow aspiration or biopsies, to detect sickle cell anemia. In the United States, they do mostly on the newborn to detect the sickle cell anemia. In case if that baby is confirmed with sickle cell anemia, they redo the test to confirm the diagnosis. Thank you.
So, these are some of the medications that are used for sickle cell anemia. We have hydroxyurea, which produces fetal hemoglobin and decreases the effects due to a sickle cell crisis. We have deferricerox, which treats iron overload that's due to secondary transfusions. We have amoxicillin that is used to prevent and treat infections, especially in small children who suffer with sickle cell anemia. They're more prone to pneumococcal infections. We have prednisone, which treats acute pain due to inflammation that's associated with sickle cell anemia. And we have oxygen that's administered between 2 liters to 6 liters for a sickle cell crisis. And this is just to prevent respiratory distress in the patient.
Hi guys, I'm Elizabeth Perez, and I'm going to cover some of the medical treatments that are available for patients that have been diagnosed with sickle cell disease. In addition, we'll take a quick look at some pretty important nursing care tips to keep in mind when providing care for patients that have been diagnosed with sickle cell disease. All right, back to treatments. The very first one on the list, bone marrow transplant. With bone marrow transplantation, we have seen some promise in the treatment of sickle cell disease. However, many of these success stories actually stem from those who receive bone marrow from an immediate relative, such as a sibling. On to blood transfusions. These blood transfusions can actually occur pretty frequently for a patient with sickle cell disease. Why, you ask? I'll tell you. These blood transfusions actually help supply normal blood cells to the sickle cell disease patient. So, with that being said, it's important for us to take caution and always monitor iron levels for these patients. With the frequency and the amount of blood transfusions, this actually puts them at greater risk of really high iron levels. All right, on to the third, gene therapy. Although research is still underway, I just thought it was worth a mention. Okay, on to nursing care tips. Very first one you see, assess circulation every 2 hours. This is so important. Well, remember, this includes pulse oximetry, capillary refill, peripheral pulses. In addition to that, you're going to monitor neurological status as well. Remember, this includes level of consciousness, orientation, pupil size, heck, even their speech. All right, on to the next one, guys. Pain assessment. Assess their pain level and assess it thoroughly. Remember that warm compresses can be provided to help relieve some of the pain that these patients are experiencing, in addition to some of the medications that were mentioned earlier. All right, remember, avoid cold compresses. Keep the room temperature above 72 degrees. This reduces the vasoconstrictive effects of cold. When providing patient education, please stress the importance of staying up to date on pneumococcal and yearly flu vaccines. This will decrease the risk of infection and hospitalization. Please also stress the importance in avoiding the following: strenuous exercise, high altitudes, cold temps, restrictive clothing, and smoking. However, you want to encourage the patient to maintain adequate hydration, as this will decrease the viscosity of their blood. Question number 1. The client's nephew has just been diagnosed with sickle cell disease. The client asked the nurse, "How did my nephew get this disease?" Which statement would be the best response by the nurse? A. Sickle cell anemia is an inherited autosomal recessive disease. B. He was born with it and both his parents were carriers of the disease. C. At this time, the cause of sickle cell anemia is unknown. D. Your sister was exposed to a virus while she was pregnant. The correct answer is B. He was born with it, and both of his parents were carriers of the disease. When both parents are carriers of the disease, each pregnancy has a 25% chance of producing a child with sickle cell anemia. Question number 2. You're assisting a physician with a sickle cell anemia screening. As the nurse, you know that which patient population listed below is at risk for sickle cell disease. A. Native Americans. B. African Americans. C. Pacific Islanders. Or D. Latinos. The correct answer here is B. African Americans. According to the CDC, 1 in 12 African Americans have the sickle cell trait, which can easily be passed to their offspring. Question number 3. The nurse is caring for an adolescent patient diagnosed with sickle cell anemia. The patient's mother asks which factors can increase the risk for developing sickle cell crisis. Which factors would the nurse include in her response? Select all that apply. The correct answers are A. Dehydration, C. Infection, D. Strenuous exercise, and E. High altitudes. If you selected all of those, pat yourselves on the back. Great job. Remember, adequate fluid intake reduces blood viscosity. Infection can lead to death in patients with sickle cell anemia. Strenuous exercise increases oxygen demand and really should be avoided. In addition, high altitudes can cause hypoxia. All right, on to number 4. During an outpatient visit with a patient who has sickle cell anemia, the nurse makes it a priority to assess the patient's A. Heart rate, B. Hemoglobin A1C level, C. Vaccination history, D. Reflexes. If you selected C, vaccination history, congratulations, you're right again. Patients diagnosed with sickle cell anemia should be highly encouraged to get a pneumococcal vaccine and a yearly flu vaccine. This actually decreases their risk for infection and hospitalization. Last but not least, number 5. The nurse is assisting the physician with a patient admitted with sickle cell anemia. The nurse is assessing circulation in the extremities every 2 hours. Which of the following outcome criteria would be most appropriate? A. Toes move simultaneously in active range of motion. B. Sensation reported when soles of feet were touched. C. Capillary refill of less than 3 seconds. Or D. No tinting present when assessing skin turgor. Great job, you're on a roll. The correct answer is C, capillary refill of less than 3 seconds. Data collection is an important aspect of the nursing process. For patients in sickle cell crisis, it's important to assess circulation in the extremities every 2 hours.